everyone, so today is a very important day for my transition, as today is the day of my SRS consultation. So all I need to do is go to London, see the surgeon, and we'll just go from there. I may even get my surgery date today. So that now that you see my journey of getting to the hospital, I'm now going to talk about my experience there. And the hospital I went to was Parkside Hospital in Putney, and that was just for a consultation. But when I got there, the staff were really friendly, very understanding, and I just had like a pleasant experience there. So I will be happy with having them to do my surgery. So after the surgeon and nurse introduced themselves, we went into a side room where I was quickly examined to see if I needed electrolysis before surgery. But luckily for me, I don't. So I'm really happy with that. And what I can understand is, if you're circumcised when you're younger, then you do need electrolysis. But if you weren't circumcised, then there's a good chance you don't, because there's enough skin without hair on it. And then after the examination, we then went to the surgeon's office, who actually has such a great view because you can see out the window and you can see like the entire London from there. So in the office, the surgeon just asked questions about my health, but said she can't see any reason as to not go ahead with surgery. And she then also just talked about the complications that can happen, but I think it's worth a risk, so I'm going to go ahead with it. I'm probably going to mess up with saying the names properly because my English isn't the best, but there's a 1 in 400 chance of ending up with a colonplasty bag, however you say it. So I was told to prepare for the worst outcome, just to mentally prepare myself. Even though it's unlikely to happen, it's still possible, so it's best to prepare for it. There's a chance that the skin could become infected and die. Another risk is that because the urethral is being shortened, there's a chance that it could cause difficulty with needing to pee, so there's a 1% chance of needing a second surgery. And there is also a small chance that I could end up with chronic pain that lasts longer than 3 months. So the current plan is to now have a pre-assessment, and the time I record this video, that's tomorrow. But by the time you watch this, surgery would already be done, because that's in 4 weeks from now. So yeah, surgery should actually be done by the time you see this video. So I am going to have to stop taking HRT on the 2nd of May just to reduce the risks of surgery, and the actual plan at the moment is to have surgery at the end of May. So on the day of surgery, I am actually just going there the day before, because it avoids the risk of me getting stressed out on the journey to a hospital. So I actually think it's better for me to go the day before, and it just helps me settle in and relax a bit. The last thing I want is to turn up at a hospital for surgery when already stressed out about the journey getting there. So while at the hospital though, I will be given daily injections to thin my blood a bit, to prevent deep vein fibrosis, how do you say it, DVT, as I will be in bed for like every day while I'm there. And on the day of surgery, I will be given like an EMA thing, how do you say it, a thing that empties out your bowels. I will then be seen by the consultant to sign like the consent forms, and then the anaesthetist will come in to give me like these big stockings to wear, just to make sure I'm safe. So while most people would like be nervous about surgery and the anaesthetic, I'm just crazy, because although it hasn't been confirmed yet, I am hoping to like have a spinal anaesthesia and be awake during surgery. So that'll basically just be, well, I'm just like numbed from the waist down, so basically the bottom half of my body is paralysed, but then I can still like think and just be aware of my surroundings. But I still need to confirm it, because I don't really like the idea of like being unconscious and not being able to think during surgery, when I think I'll be better off if I was awake for it. So yeah, I am going to ask for spinal anaesthesia and just be awake during surgery, because I'm crazy like that apparently. It also avoids the risk of like general anaesthesia, because I don't know how it would affect me, and I'm just going to try and avoid it as much as I can. Hopefully I don't need that at all, because I am perfectly happy with just laying on the operating table wide awake during surgery. I won't be able to see anything anyway, because they put a large sheet in the way, and the only thing that happens is that I'll be able to hear things but I'm not be able to see it, and sometimes I may like feel my body being tugged or whatever, but it still seems much better than being unconscious to me, so I'm going with that option if I can. I have read online that SRS can be done using spinal, so I don't see why I can't do it. But after surgery I should be in hospital for around 6 days, and that's just basically to monitor me, to make sure I'm okay, and if everything goes well, after those 6 days I can go home and recover there. I will go into this in more detail in a future video, but basically after surgery, to stop like the vagina area from closing up, you basically need to dilate for like an hour a day, which is basically like 20 minutes 3 times during the day, just to like stop the hole from closing up. And basically I'm going to give like a little demonstration of what it's like. So all you need to really do is imagine that's a hole and that's the dilator. Do that and hold it there for like 20 minutes. Basically when you get home, you are just like meant to rest and look after yourself for a few weeks. But I am probably just going to try and get out of places, because that's just like the way I do it. But after around 3 months, just basically normal stuff can resume, and life should just go like back to normal, apart from still needing to dilate. But yeah, I'll talk about that in a future video once I properly know about things. But in the next video you should be seeing will be about my I think it's a pre-op assessment. That's the last one that's been done before surgery, because the video after that will be a surgery video. And also, when I said that I'm going to have a cosmetic version of SRS, since I talk about dilation, it's probably quite obvious now that I decided to go for full version.
Yeah. 14 to Warren Street.